Hi, everyone. Welcome to today's episode. We have an amazing program. I'm joined by Dr. Louis Aronne, a leading authority on obesity and its treatment. He's the Stanford I. Weill Professor of Metabolic Research at Weill Cornell Medical College. And I'm also joined by Malcolm Beasley, who is the founder and CEO of PCI Medical. And Malcolm is an expert in medical education. How is everybody today?
Great.
Great, Dario.
Awesome. Well, let's jump into the interview here. This is going to be great. First question, I'm going to, Dr. Aronne, this one's for you. So you're recognized as one of the leading experts in obesity treatment. Can you tell us about the current state of obesity medicine, why education is so critical right now?
Well, Dario, there's been incredible change going on in the treatment of obesity over the past few years. I've been in the field for more than 35 years. I've done more than 65 clinical trials of treatments for obesity, so we've experienced a lot of failure. But now we've had enormous success with the last few medicines, and there are dozens out there that are now in development. So the results we're seeing tell us that there's going to be a change in the way we treat metabolic disease. We're no longer going to be waiting for people to develop diabetes, heart disease, sleep apnea, and the many complications of obesity. We're going to be treating their weight first. And so it's important for physicians to recognize this and know how to deal with obesity, with patients with obesity, and with their treatment. And we don't learn about this in medical school. This is still not taught in medical schools. There's no drive to educate people. And this is left over from the last generation when there wasn't that much to do. But now we're seeing a tremendous change because there is something that can be done. There's a reduction in mortality. We're seeing a reduction in mortality. And all of a sudden, that will throw the burden on the physician to be sure that they treat obesity because they want to reduce the risk to the patient, not of just the complications, but the risk of death. So I think we're in the middle of a massive changeover in the treatment of metabolic disease.
And what are you seeing in terms of the HCP preparedness for this rapidly evolving field?
Well, as one of the founders of the American Board of Obesity Medicine, which was about 15 years ago, we initially, I'll just give you one idea. We saw 300 people who were board certified the first year, and a few dozen people took our board exam. Last year, over 2,000 physicians took the exam and were certified. So this is a massive change. We're seeing incredible interest among healthcare providers of all types, not just physicians, but also physicians' assistants and nurse practitioners. And I think it's only going to continue to grow. We're still treating just a small number of patients, but the vast majority of the population of physicians and other healthcare providers is not well educated. They're not well educated about obesity and its treatment. And I think that's going to change. I think the demand for obesity education has never been greater.
So Malcolm, from your perspective, working in medical education, what are the most significant needs for obesity education for healthcare providers and pharma medical marketing and sales teams?
So HCPs need guidance on understanding obesity, conceptualizing obesity as a chronic disease with significant morbidity, and then treating it accordingly. HCPs need education on how to effectively treat obesity, how to manage common side effects, and the need for patients to continue on therapy in order to receive benefits. And HCPs can greatly benefit from experience of KOLs like Dr. Aronne, who have been treating obesity for decades in terms of best practices and how to discuss obesity treatment with their patients, with a recognition that patients have often failed numerous prior attempts to lose weight. And for pharma, there's a need to bring their people up to speed on the clinical trial programs for the GLP-1s in obesity, as well as in the numerous other areas that GLP-1s have and are being studied, including heart failure, sleep apnea, and CV risk reduction. And they need to understand the complication-centric approach to obesity, where the goal is to prevent downstream medical conditions such as diabetes. And finally, they need training on the pathophysiology of obesity and why obesity has been recognized as a disease and how this informs their approach to patients.
And Malcolm, how does obesity education differ from other therapeutics areas that you've been involved in?
Well, I think what's different is there's significant healthcare bias and stigma around obesity, and this is something that's typically not seen in other therapeutic areas. And HCPs need to be aware of these issues to inform their approach to patients.
Dr. Aronne, would you like to comment on that?
Yeah, I agree with Malcolm. The demand for obesity education is massive, and he brought up an important point that I didn't bring up. I was just focusing on healthcare providers, but in fact, the entire industry, the pharma industry, needs education. So that one of the things we see are that people who work for pharma don't really understand obesity. They have outdated ideas about what causes it and how it should be treated. And that is a liability for a company that's developing drugs. I'll give you an example. The clinical trials that we work on, we have about 7 clinical trials here at Weill Cornell going on right now, and there are dozens. Every couple of weeks, I see a new trial of a new compound that's being developed. The doctors who are designing these trials at the pharma companies have no experience in obesity treatment. And they're using a set of assumptions that are applied from other trials they've done, for example, in oncology. And it's a completely different animal. It's a very different set of circumstances when you're treating obesity versus treating cancer or other forms of metabolic disease. And so all of these people need to get up to speed to really understand where to go. And it's a huge number of people who are going to be involved in this. When you look at the size of the potential market, this is really going to be a big, big change. So I think that the demand and the need for it, I mean, anyone who is running a pharma company right now wants to be in obesity treatment. I think, we see that. And in order to do that, they've got to educate their people about it. We run a fellowship program. There are about 30 fellowship programs in obesity medicine around the country. So we're training the leaders of the future. And this is a 1-year educational program where physicians come and work with us for a year. They're right out of their residency, or in some cases, they're gastroenterologist or pediatric endocrinologist. And so we know how to educate these people. Dr. Apovian, who's a co-author on our book, she also runs a fellowship program. And our third co-author, Dr. Barenbaum, she runs the fellowship program here at Weill Cornell. She's the co-director of the fellowship program. So we know what people need to know in order to learn to treat obesity properly.
Dr. Aronne, you mentioned something interesting, which was, say, like a difference between treating obesity and oncology. Give us an example about the differences in the educational approach for those two areas.
Sure. One of the key differences is that most physicians know nothing about obesity. So when you get to your residency or your fellowship or you start treating, you've heard about cancer. You know about cancer. You've seen patients in the hospital who are being treated appropriately with chemotherapy, immunotherapy, radiation, surgery. People who are in the healthcare professions have never seen anybody lose weight successfully. And they've never seen people treated the way they should be treated. They've been treated like it's their fault. And it's not someone's fault. That's one of the core messages of the education about obesity for healthcare providers is it's not the patient's fault. It's just like diabetes. Something changes in the weight regulating pathways, the way they change in blood pressure, cholesterol regulating, blood sugar regulating, etc. And that's what causes people to gain weight and not be able to lose weight. So that I would say is probably the number one
Mm.
most important thing. Is that people don't believe that obesity is a disease, so why would you treat it? But right now, we have very convincing evidence that that is not the case. And the most important is that we have rationally designed drugs that are very effective and where the results are clear that health benefits are being seen. So I think we're in the middle of this massive transition. I mean, let me give you just one
Sure.
example,
Yeah,
Barry.
please.
We published a paper in the New England Journal of Medicine in November where we treated people with tirzepatide, a GIP, GLP-1 agonist that produces 20% plus weight loss. We gave it to people over a 3-year period, people with prediabetes. What we saw was that there was a 94% reduction in the risk of developing diabetes
Wow.
over those 3 years, 94% reduction. So these are people who are on going at some point highly likely to develop diabetes, but there was this massive reduction. So what does this say about the future of metabolic disease when, it's possible that most of the people who will develop diabetes don't have to develop it?
Mm.
Their blood pressure also was better. Their lipids were better. Signs of inflammation were much, much better. And the list goes on and on. So that is what is going to predominate. And yet out there, people don't have no clue about this area. But, our role is to make sure they get educated properly so they're treating patients properly, so they know how the medicines, which we now know work so well, how they work, how to manage the side effects, and more than that. There's a lot more than that.
Fascinating. Malcolm, how do you address these educational gaps through the types of programs that you develop with Dr. Aronne and the Obesity Society?
Well, one of the primary ways is that we publish Dr. Roney's Clinical Management Obesity Handbook ebook that is co-authored with Dr. Apovian and Barenbaum. And that book provides clinical guidance on obesity, how to treat it, the results of the clinical trials on all available obesity medications with a focus on the GLP-1s. We've been working with the Obesity Society to provide this resource to FP and IM residency training program directors to provide to their residents, as well as to the obesity fellowship programs. And the handbook has also been distributed at the AAPA and AANP annual meetings.
Excellent. Dr. Aronne, can you discuss the educational needs around GLP-1s themselves, not just the side effects, but understanding the clinical trial data in obesity and other conditions?
Sure, Dario. GLP-1s, which, 5 years ago, I saw a patient the other day who said, I came in 5 years ago and you told me you wanted me to take an injection because I had a body mass index of 40. I could either go for surgery or I could try this treatment. I thought you were crazy. I'm going to take an injection once a week. And that injection was Ozempic, now Wegovy. And he said, 5 years ago, everyone, I thought you were crazy. Now it's like everyone in the country knows what these things are. So the changeover, now that we have these effective treatments, has been massive. So it's important for practitioners to understand how these work, where they work best, which one should be chosen. Are there any alternatives? What are the side effects? This is perhaps the most important part. If you're going to decide to treat someone, what are the side effects and how do you minimize them? I love telling doctors when they say, "Oh, you can't use them. Well, look at all those side effects." I say, "Look, if this didn't work, if this treatment didn't work, I would not have this job. I would not, Weill Cornell wouldn't employ me. We wouldn't have 8 doctors and 3 nurse practitioners. We have 11 providers, now 12 providers, who are delivering care and thousands of patients. If it didn't work, we wouldn't be here. So how does that happen? Those are the kinds of things that practitioners need to learn so that they can treat their patients in the manner they should be treated. And one of the things we've seen are people going outside the healthcare system
Right.
to
Right.
get these. The demand is so great. Like people know that deep inside that if they could lose weight, they would feel better and these problems would get better. And so they're going to sources that are not the best. Let's
Right.
put it that way.
Right.
That are in some cases, it's hard to believe some of the things that we've seen in patients who come in and say, "Oh yeah, I ordered this online." They got a piece of paper that explained how to do it, and a bag of medicines. I actually have one right here. Look at this. Patient got this.
Oh my
Yeah,
goodness.
this was
Wow.
it, and there's a piece of paper that went along with it. That is not the way to treat a chronic metabolic disease that if you treat it properly will prevent so many other illnesses. So
Gotcha.
I think that it's really key for physicians to know the clinical aspects of this management. And again, a few
Mm.
years ago, they were like, why bother? Now it's critical for anyone in primary care,
Mm.
anyone in a specialty that's related to these diseases to know about this. I don't know if you saw, but just a week ago, semaglutide, which is Wegovy for weight loss, got approved for a metabolic
Right.
liver disease. And I mean, that's a huge change. So now you can not only manage metabolic associated liver disease, but you can also treat all those other complications that we see in in addition to it in patients. So how many patients do doctors see who have that? The list goes on and on. The list goes on and on. And I just wanted to show you this. Here's the live, real paper
Yeah.
version of our ebook.
Yeah.
But the ebook is great. And the Obesity Society, we really appreciate collaborating with them to make it available to practitioners out there. I think it's really going to change the way that people practice.
Excellent. Excellent. So, Dr. Aronne, with so many obesity drugs in the pipeline, how do you see treatment evolving in the near term?
Well, I think that we're going to be headed in a direction like the treatment of hypertension. Way back when, if you go back to the 1960s, there were only a few medicines available and they weren't very widely used. And people were treated at very high blood pressures. And in a lot of cases, the damage had already been
Mm.
done. So there wasn't the benefit that everyone thought could be achieved. However, as time went on, more research was done and better medicines were developed. It was clear that you could prevent most of the complications of hypertension, stroke, heart attack,
Mm.
heart failure, etc. And so by the 80s, when the new generation of drugs like ACE inhibitors and calcium channel blockers were approved, that was a massive change where before that, it was very hard to treat hypertension
Mm.
and it was treated at very high levels of blood pressure. And then all of a sudden, it was 140 over 90 and then 135 over 85. And now virtually no one has severe hypertension if they check their blood pressure. I think we're going to see something that's very similar, where we now have the first really effective drugs, and people at high levels of
Mm.
obesity are being treated, and we're able to see the incredible benefit that can be achieved. And what will happen is that more and more drugs will become available with different mechanisms of action that will give us even better results. And we're going to be able to minimize the side effects that we have right now. One thing that people always bring up to me is, well, what about the muscle loss?
Yeah.
People do lose lean mass as they lose fat mass. And because they're losing so much weight, it can be significant. Well, we have a paper coming out showing that we've been able to minimize the loss of lean mass in people taking a GLP-1 for weight loss. And I don't want to say it's eliminated,
Yep.
but it's a lot less. And also, the amount of fat mass that is produced is increased. So if you look at it as an equivalent, fat loss equivalent, it's minimal amount of lean mass loss with exaggerated fat mass loss. That's just what we want. And all the metabolic parameters, they generally go in the right direction.
Excellent.
So I think
Excellent.
it's a very exciting future.
For sure. So, Malcolm, what about educational strategies for bringing HCP's pharma medical marketing and sales team up to speed in some of these combination therapies that Dr. Aronne refers to?
So, excuse me. So some of the ways to educate on combination therapy would include short explainer videos with
Mm,
graphics to explain the MOAs of the different medications comprising the combination areas. Also, KOL presented videos on the thinking behind combining agents with different MOAs to treat obesity, perhaps combined with a medical background or an executive summary. And also resources on the results of clinical trials of combination agents and how they compare to single agent therapy, including side effect profile of the combination therapy versus single agent therapy.
great. Well, Dr. Aronne, you're the clinical expert, and Malcolm, you're the educational expert. Tell us a little bit about how the two of you work together.
Well, we've been working with the Obesity Society to produce a comprehensive obesity training program for medical affairs personnel. And this has consisted of interactive training modules that combine didactic material with KOL presented perspective videos, pre and post testing, and self-assessment quizzes. And the program covers the state of obesity, the clinical trial data for all oral and injectable medications for weight loss, and the rationale for long-term obesity medication use, and the efficacy of GLP-1s for treatment of obesity-related complications such as type 2 diabetes, cardiovascular disease, and sleep apnea.
Dr. Aronne, what about from your perspective?
Well, I think that working with the Obesity Society is really, I was formerly the president of the Obesity Society, and I think that the role the Obesity Society plays in educating physicians is central, much like other societies, the American Diabetes Association, the Heart Association. They all have their constituencies of people with interests in those areas. And I see the Obesity Society as central with the body of knowledge that we have as obesity medicine specialists. So we have people at all these different societies. I mean, that's one way we're doing it. We all get asked, people from the Obesity Society get asked to go to these different societies to educate. But it's enduring material, I guess, is what is going to be necessary because this is such a gigantic problem. Like you can't have all these people to a meeting somewhere in, Chicago at the convention center. I mean, you'd have hundreds of thousands of people in the healthcare industry need to be educated. And that's why in our collaboration with the Obesity Society and providing our book for people to have, I mean, everything you need to know about obesity is in here. I mean, there are
Wow.
some things you can't teach in a book, like seeing patients in the office. I mean, but that can be duplicated in videos and in other formats. So I think a lot of the education can be duplicated. What we use to train our fellows can, in a mini way, be duplicated using video materials and other types of educational programs.
Great. Um, so, Dr. Aronne, you mentioned that you were the past president of the Obesity Society, and they have Obesity Week, but
Mhm.
in November. Tell us about just the importance of that Obesity Week and how I guess maybe HCPs can best take advantage of it.
Sure. Um, Obesity Week has been going on for almost 20 years now. As an organization, the Obesity Society has been around since the mid 1980s. I was president in 2005, which interestingly was when the first GLP-1 for diabetes came out, which was called Byetta. So there has been an evolution in the society as there has been in the field. And I think that one thing that physicians will see if they come to Obesity Week is that they realize that there are thousands of other people who think the same way. Because often in your own institution, people are like, obesity, you're going to treat obesity. And again, this is changing. But going to something like Obesity Week, where there are thousands of people who are talking about this, like, oh, yeah, this is all we do all day long, can really help people to get energized, to get enthused. And hearing cases and other kinds of results, the latest results, I think is a great way for healthcare providers of all types to become energized and get to that level of education you need where you can do the rest on your own. So I'm very enthusiastic. I think Obesity Week is going to continue to grow over the coming years.
Yeah,
Excellent.
Dario, one other thing about that is
Yeah.
Dr. Roney's obesity handbook has become basically a flagship educational resource for the
Mm,
Obesity Society. That, in addition to being a valuable obesity educational resource on it also served as a promotional vehicle for the society.
mm.
So, collaborating with medical societies such as TOS enhances the perceived credibility of the resource created, and the dissemination to their communities allows reach to a very important audience.
Great. Well, we've covered a tremendous amount of ground in a very short period of time. One last question, Dr. Aronne, just if you could just summarize maybe what are two or three key takeaways for the audience?
Key takeaways. Number one, treat obesity first. I think that is where we're headed. And when it comes to recognizing obesity as a disease, I think that anyone who doesn't know about obesity, once they get into it, they're going to recognize that it really is a disease in many different ways, and will recognize the importance of treating it and the value to their patients. One of the most exciting things about my job is seeing patients succeed. People who couldn't lose weight, people who are really bogged down in their lives by their weight. And we ask every patient when they come back, how do you feel? People are like, I feel great. My whole life has changed. That's not everybody, but many people find that their entire life changes as a result of the weight loss. And we're not talking about trying to get people to be skinny. That is not what we are about. We're trying to get people to be healthier. And it doesn't take that much weight loss to achieve an improvement in health that really can energize patients and be life altering. So I think that understanding that there are people out there who are really weighed down by their weight, and you can give them a new life. I think that, to me, that's the most important message for any provider or practitioner who is interested in this field.
Excellent, excellent. Malcolm, any final words before we wrap up?
Well, we're seeking other opportunities to expand the dissemination of the obesity handbook ebook to HCPs via integrated delivery networks, medical societies, medical platforms, and through pharma. And we're also looking for opportunities to create custom educational resources to address specific obesity educational needs. And we'd love to talk to those who are listening.
Excellent. Well, Dr. Aronne, any final thoughts?
Dario, I think that this has been great. Thank you for your time and for your interest in our field. But I would second what Malcolm has to say. I mean, we're working now with major healthcare networks We're working with an entire state to implement
Wow.
obesity treatment throughout the state using a tool that we've developed. So I think, again, that this is something that is only going to be growing. It's not a passing fad. Anyone who thinks that is completely wrong. We've already shown that you could save money treating obesity in people. So if you fund healthcare, this is of critical importance to you. And so I think that this kind of education is increasingly important, and I'm thrilled to be working with Malcolm and his company in trying to get the message out there.
Great. Well, thank you so much, everybody. This has been just an amazing session, and all the best of success moving forward.
Thank you.